Okay, so let's get started. So Dr. Hale, let's start with something pretty general. So if you wouldn't mind, could you just give an overview of what ABA therapy is and if there are different types of ABA therapy? And just for everyone, ABA stands for Applied Behavior Analysis.
Thanks for that question, Vincent. And before I go into it, I just really want to thank you and the Spark team for having me, and for everyone who's joining this afternoon, because I know everyone's has a busy Thursday, so I appreciate you all taking the time. So I'll try to sum it up, in as briefly as I can. So ABA stands for Applied Behavior Analysis, and it's a type of therapy that the applied part of that term really means the application. And so it's the application of behavioral science principles towards the treatment of some presenting problem. And so that problem might be behavioral excesses, like someone that's engaging in too much of some problematic behavior, like aggressive behavior or tantrum behavior or self-injurious behavior. So using behavioral principles to address those problems. But also sometimes there are behavioral deficits. So someone who's maybe not engaging in enough community needs and wants met. And so applied behavior analysis therapy utilize principles to the same behavioral principles, right, from the science, apply them, the application towards helping someone improve their communication skills or other skills that they may have deficits in. But basically the principles primarily revolve around the use of, I mean, this is very, oversimplified, but generally revolve around arranging the environment to promote learning through using rewards and contingencies such as positive reinforcement and things like that.
Okay. So as some in the community know, there are folks that have negative feelings about ABA. But however, it's shown to be an effective treatment for ASD. Just generally, what do you think of ABA and how would you respond to those who think that it might be harmful?
So, and this is a topic that comes up a lot. I think there's a history of some of the strategies that behavior analysts have used that in retrospect maybe weren't the best choices. And I don't mean that in that I think anybody went into the field to do harm, or that necessarily most people did harm. But I do think, it's an evolving field in the sense that when clinicians first started using these principles of science to address behavioral concerns, we really didn't have a guiding ethical body to guide us in terms of how we deliver those clinical applications. And so there was a huge variety in how ABA got applied across different clients and so forth. Some better, some more appropriate than others. And so, we're sort of in this field where we have a history where some people were doing things that weren't maybe as nurturing and kind as, we have learned that we should be. But now as a field, we are most behavior analysts are certified by an overarching body that does have ethical guidelines, and so I think we've come a long way towards. And I also I was talking about this with my students last night, like the families who've experienced behavior analysis and felt like that doesn't feel right, like it feels maybe too punitive or too demanding or something like that. I mean that kind of information that we've gotten from families and from adults now who have received ABA services early on. I mean, that's really helped us as a field better understand the impact of what we're doing and how important it is for us to really take the time to approach our strategies in a way that is much more compassionate and tailored towards really meaningful gains that have meaning to the individual and the family, and not just kind of arbitrarily delivering interventions. And so, I think that we're as a field. I mean, there's obviously variety in how in every field, right, in terms of quality of service delivery. But I can say now as a field that there is a much bigger emphasis collectively on us trying to rectify some of the problems that were, evident early on, and making it so that the services are delivered in an ethical and an appropriate way.
Mhm. So kind of related to what you were just saying, how would a parent know if ABA was right for their child?
That's a good question. So I think right for your child maybe is comes from two different things. Like one, is this therapy a good fit in terms of like the goals that you have clinically? Could your child benefit from ABA? And so, I mean, there are some. If the issue that if you're concerned about it has to do with some kind of behavioral excess, too much of some behavior, or behavioral deficit, not enough of some behavior, then that's probably something that you might consider an appropriate challenge to be addressed by a behavior analyst. But I think the other question goes back to this ethics. Like, it's not just could the behavior analyst address it, but is this style of therapy going to be a good fit for my child? I typically tell families that, outside of maybe getting to know your therapist, kids should like going to behavior therapy. They should show some enthusiasm about it. It should be generally a positive, pleasant experience. And I think for any parent, you have to trust your gut if your child is in distress or upset. And I think, you want to, like, some kids are in distress just because it's maybe the first time they've ever separated from their parent, or that kind of normal, stuff that we have to give kids time to sort of warm up to a new person. And I don't mean that, but I mean, in general, once kids get to know their therapist, they should enjoy going to therapy, and you should see that. They should show some excitement, some enthusiasm. And those are the kind of signs that I would tell a parent to look for, that it should generally be a positive experience.
Um, I guess, how long should someone go to know that it's the right fit? And if would you recommend that someone switch? And if so, when would that timeline be?
So it switched to another therapy, you're
Yeah,
asking?
yeah.
Yeah. So, I think individuals learn at different rates, right? And so some individuals will enter ABA therapy and you can see progress pretty quickly, um, in some areas, just depending on kind of what that issue is and what the kids bring to the table in terms of their learning before they get to ABA therapy and things. So, it's not unusual for kids to make some progress pretty quickly. And that progress is usually conveyed to parents through their behavior analysts, showing them uh, data they've collected in session, and showing them examples of the things that their kids can do now that they couldn't do before. Um, but some kids move more slowly, and so there are sometimes that it takes a while to sort of have an impact, the therapy to have an impact. Um, those gains aren't immediately obvious, right? And so that's when I think it's a little bit trickier, because a slower progress doesn't always mean it's not working. I think it's just like a conversation that you want to have families should have a really open conversation with their service provider, and just be clear about, like, this is not moving as quickly as I expected, and is that problematic, and do we need more hours? Do we need another type of therapy? I mean, yeah, I mean, I think parents, oftentimes their gut is what needs to guide them, and just be, kind of ask a lot of questions. But I don't know if that answers your question, but I don't know that there's a perfect answer to that.
Yeah, yeah. Um, you had mentioned earlier aggression, and so are there any sort of behavioral interventions or techniques that you would recommend to help with aggression?
Yeah, and it's funny because I think a lot of times when people talk to a behavior analyst, they assume that there's a specific treatment for each presenting problem, like how do I handle aggression or how do I handle self-injury. And what's special about behavior analysis is we don't really care so much what the behavior, I mean, we care in the sense that obviously we want to address problem behavior, but the treatment itself is guided less by what the behavior looks like and really more by what's going on in the environment that might be contributing to that problem. So if someone's aggressive, for example, I wouldn't say there's kind of a universal approach to addressing that. But what I would look for is, are there things that are motivating that individual to be aggressive in terms of, are they in an environment that's particularly stressful that they're acting out, aggressing to get away from somebody or some situation, and so we might, work on teaching them better ways to communicate their frustration so that they don't have to rely on aggressive behavior to communicate that. So it's not so much a treatment for aggression as much as it is a treatment for the environment. Like, how do we arrange the environment? How do we give them the skills so that they can communicate what they need, are frustrated about, but do it in a way where it's not, a dangerous behavior, that it's a more effective way. Yeah.
Mhm. I just saw a question here from someone on the line. They want to know, is there a difference between ABA and then a sort of general term behavioral therapy?
Yes. So I think behavior therapy is just a very general term, right? It incorporates a lot of different types of therapy. And so ABA is like kind of a specific, it's more specific, I guess, than behavior therapy at large.
It's just sort of a general term for different kinds of,
Yeah,
yeah.
and it's probably not super well defined, right? So ABA is more well defined, but behavior therapy is kind of a general umbrella term to talk about any kind of behavior. But I mean, I think sometimes people use those terms interchangeably in conversation without, meaning one is the same as the other, just sort of colloquial.
Mhm. Um, what are some other kinds of treatments or therapies that you know of that families could
Mhm.
seek out other than ABA?
So, I mean, obviously it depends on the presenting issue, right? But for a lot of individuals with autism, if they're getting ABA, a lot of times they're also getting speech and language therapy. Some individuals are also getting occupational therapy. Uh, Sometimes individuals are under the care of a psychiatrist or a psychologist. Neurologist, right? So, and all of that would depend on what the presenting issues are.
Mhm. Another question just came in. Would you recommend that individuals seek out a BCBA or master's level or doctorate level clinical therapist when looking for someone for ABA?
So the certifying body is that is most recognized in the United States is called the Behavior Analysis Certification Board, BACB. So I would generally recommend that you look for someone who is a board certified behavior analyst, BACB, and or BCBA. Sorry, I said that wrong. BCBA, and so that's someone who has met the educational and training requirements and passed a board exam to have that certification. Now, some people, depending on states and licensure, can call themselves a behavior analyst and work. But it's really that certification, whether that person is a master's level or doctor level, probably matters less. Is probably a less important distinction than just making sure you're working with someone who is certified, so board certified.
Mhm. Um, let's see here. I don't know if you'll be able to answer this, but do you have any strategies about how to navigate if insurance doesn't want to pay for ABA?
I don't know if I have any strategies, but I have compassion and recognize that this is a problem that is huge and affects families all over the place. For many years, Florida did not cover ABA through insurance, and it's only been in the past few years that Florida's initiated an insurance mandate. And even with that, so I'm in Florida, but even with that, there's exemptions such that some insurers, Florida insurers, aren't required to cover ABA services. And I know that it varies from state to state. So, I mean, Autism Speaks has people working on that. There's a lot of advocates out there working on that who are trying to, you know, change the regulations so that insurances are required to cover, because it's, I mean, it is a pretty evidence-based treatment in the terms of insurances. You know, some of them will try to come up with different reasons why they won't cover it, but it's a frustrating problem. It's a pervasive problem, and I certainly do not have the solution for it.
Yeah.
But those families that are struggling, you are not alone. Like this is something that, you know, many families are struggling with.
So we have another question that came in. Obviously, we're learning more and more about genetics and autism. And so if someone has a genetic diagnosis, do you recommend anything in addition, or would, you know, services sort of remain the same? Or if you can't sort of speak to this, who do you recommend that the person chat with more?
That's a really good question. And I think, you know, so for ABA, really each therapeutic program is individually tailored to what each client needs. And so the identification of a genetic marker may not change the course of the ABA treatment so much. But, you know, knowing that someone has a certain genetic marker may be informative for other reasons in terms of behavior patterns we might expect to see, or medical, you know, comorbid medical conditions. I mean, I think that certainly you'd want to be in touch with some kind of physician, whether it's a geneticist or neurologist, or, you know, if there's seizures involved or something like that, who can guide the behavior analyst in terms of any medical issues that might be also implicated. But I think this is an area that we really have a lot to learn. Like, I think this is one of the reasons Spark is going to be so helpful, because we don't yet know necessarily what certain genetic markers, if those are indicative of common behavior patterns. I mean, I'm sure we will find that is, but it's still something we just don't know enough about.
Okay. Is it true that ABA is most beneficial for the child before 6 years old? Someone said that they were told this by another person.
So, you know, so we talk in generalities. It doesn't, yes and no. You know, when kids are before the age of six, we tend to think of their brain as very kind of malleable, like clay-like almost. You know, you more you push the brain connections in the right direction, you know, they're less static, less plastic. And then as you get older, as your brain becomes more, those connections become more formed, it's harder to have an impact at that level of, you know, and so with the early intervention, we do sometimes see really significant gains in learning. But I mean, kids still learn after 6. You know, you can take any 6-year-old and they're nowhere near the level of adult knowledge. There's a huge amount to learn between the age of 6 and, you know, 25 or wherever, till your brain is totally formed. So, you know, I still, there's a lot that can be done with ABA past 6. And, you know, the impact of early intervention for some kids is really big, but you know, it's not that at 6 something magically happens where, you know, you jump off a cliff and everything changes. I mean, there's still a lot that can be done, still a big impact that can happen after 6. So I mean, I definitely don't think that it's too late to start. And some kids after 6 continue to make pretty remarkable gains.
Mm-hmm. Do you have any recommendations for resources for professionals in schools who may be working with students with autism or even ADHD?
Oh, goodness. Um, so I think in schools, I, I don't have any specific recommendations right off the top of my head. I mean, I can certainly share some, but I think in schools the questions are sometimes different. So, with schools, there are some, um, uh, you know, laws that in IDEA, for example, that talk about what needs to happen in terms of supporting behavior in the classroom and things like that. So there's lots of literature on functional behavior assessment and developing behavior plans, and all of that information is very much tied to IDEA, the Individuals with Disabilities Act, and IEPs, and that. And so that's oftentimes how ABA kind of links in with the educational system.
Mhm. Someone is saying that their child is very self-directed and controlling, and that the therapist was trying to sort of help with that, but the parent has some doubts. So, is there some middle ground, or do you suggest the parent works, really closely with the therapist? Do you have any sort of tips around how they can manage that situation?
Yeah, will you clarify for me? So the therapist feels like the child is. Tell
Is
me again.
controlling and self-directed, and
And
but the parent kind of likes that
like
behavior
that,
to
yeah,
some extent.
yeah, and I think there's value in that, right? There's value in sort of being your own self advocate, and um, letting people know what you feel strongly about. And so I can imagine that a parent wouldn't want to squash that
Mhm.
behavior completely. But at the same time, there's a balance there, right? Like sometimes as a child, you have to do what adults say, and you have to sort of follow the classroom routine, right? I mean, that's sort of, and I don't mean do it for things that are unreasonable or unfair, but I mean that's generally like how we go to school, like and are successful in life. So I mean, there really should be. I mean, I think the parents' right to feel like there should be some respect for a child's autonomy. Like a child should be able to communicate what's important to him or her, and we should appreciate that that's kind of how that child is. But at the same time, like we also want to give children the tools to be successful across a range of environments. So, how can we teach them to be receptive to other people's suggestions and open to other people's ideas, and compliant with those kind of behavioral demands that we all experience as we're growing up and even through adulthood, so that that child can you know fit in as needed without squashing their independence and
Mhm.
wants.
Okay, so do you have any recommendations or opinions, advice about the intensity of ABA? So, does it
Mm.
make more sense to have an intensive course for a short time or once per week? I guess, what are your thoughts around that?
Yeah, and so this is, something that comes up a lot because how much is essentially it's like a dosage. How much should someone be getting of ABA therapy? And you hear recommendations that range widely. Like some kids will be getting 40 hours a week, which is like a full-time adult job, right? And some kids are getting 20 hours a week. Some kids are getting 5 hours a week. And like, what point is it too much or too little? And uh, and so usually what happens is that when someone initiates behavior ABA therapy, the clinician will make a recommended amount of treatment. Like I recommend we start, and that recommendation is based on kind of what the child presents, their age. I mean, I wouldn't recommend 40 hours for someone that's 18 months. Like 18-month-olds, they sleep a lot still. And like, I don't know how you would even find that many hours in a day, but so, I mean, there's a balance there. And but then once you start the therapy, sometimes you realize like kids are really, they maybe don't need as much as you recommended. Like they're progressing really quickly, And we get through a lot of programs and then we're kind of done and we don't need as much time. Or other kids, like the progress is not as quickly as you imagined, and so the therapist might say, you know what, I think maybe we should do more hours. So that initial kind of onset of therapy, it's your best, the clinician's best guess. Like they're sort of just saying, like, this is what I would recommend, but we're going to have to see what happens when we start and then make adjustments. And so the clinician usually guides that process. Now, if a child is in school, for example, the amount of ABA might be more limited because they're getting that after school. Or if a child is in other therapies, that might, be something to take into account. So, I mean, there's variability, but I would certainly communicate with the certified behavior analyst about the dosage and the amounts and what their recommendations are, and have that communication kind of open and continue to adjust as appropriate.
Probably have time for one or two more. Do you see a shift toward parents becoming more involved with therapy at home, or are there even models where the parent sort of acts as a therapist for their child?
Hmm. Yeah, I mean, in fact, in the early ABA studies, we're talking about the Lovaas studies from 1987, parents were the implementers of the treatment. So that's been a long time in our history where parents have taken an important role in that. I think that probably varies from provider to provider in terms of how much parent involvement is. A lot of behavior analysts will do a lot of parent training and spend a lot of time on that. Sometimes less so. I think it varies for me. In my experience, it varies a lot by families. Like I think being a parent's really hard, and asking a parent to do all of this therapy on top of being a parent is. And I'm not, this is not a criticism of parents. Like I think it sometimes is unreasonable to expect that they're going to be both the therapist and a parent, especially if they have multiple kids and work demands and so forth. But there are parents for whom that it just comes easier to them, and that's how they invest their time. And so, yeah, I think parents can be really integral part of the therapy, but it's not required either to. I mean, we certainly want parents to carry out some of the things that we're doing, but in terms of the delivery of the services, it varies.
Okay. Well, we are at 12:30. That went pretty quickly.
Yeah.
So really appreciate you taking the time here and answering questions. We actually, I pulled more from the chat than I thought I would. So this is great. And hopefully we are able to give you all a little bit more information than you had coming in. Just a reminder that we did record this talk, and it will be posted on our website and our YouTube channel in the next few days. Thank you all for being here, and to Dr. Hale.